Hi guys, welcome to the week 6 lecture. I can't believe we've made it this far. I know, I'm excited. So, week 6, we're going to be focusing on the abdomen. The abdomen is a very, I like to call it like a very dense part of the body just because a lot of structures are in there, very important structures, and it's fun because you really get to, this is what I call like the meat of anatomy. This is when you really get to scroll through CT scans and you're like, oh, I see a lot of stuff. And it becomes really fun trying to identify where these structures are. They're also not bones, so they're not rigid, so they can sometimes be in different positions at different times depending on the respiration, depending on how the patient is lying. So it kind of has you use your critical thinking skills just to a little bit of a higher level. So starting with the anterior abdominal wall. The book starts going over the muscles that make up your anterior abdominal wall. The first muscle that they go over is your external oblique. So this is the most outer, most superficial muscle in your abdomen. It actually extends from the outer lateral of the body to the midline. So that's kind of like the trajectory that it's taking. Next is your internal oblique muscle, very similar to your external oblique. So if you open the external oblique like a flap or like a door, sort of like this, you're going to find your internal oblique. The only thing is that the striations are they're not like exactly one on top of the other. It's similar, but not exactly one on top of the other. So that's how you can tell that it's a completely different sheath of muscle. And in this occasion, it just looks like it's running from the midline to the lateral aspect of the body. Next, you have your transverse abdominis. So below, more or deeper to the internal oblique is the transverse abdominis. And your transverse abdominis, like the name states, it's traveling in a transverse. The striations are traveling in a transverse direction. What does that mean? The transverse plane, if you go back to week 1, transverse goes from left to right on your body, slices your body kind of in half. So transverse abdominis muscle, it's exactly what the direction that it's gonna be going from. It runs from side to side. And then finally you have your rectus abdominis. Your rectus abdominis travels from your xiphoid all the way down to your pubic symphysis, and it has different, they call these, let me just double check, fibrous bands. So it has 3 fibrous bands where if you lose a lot of body fat and you're very thin or very muscular, you're able to kind of see the muscle come out and then tuck back into that fibrous band. Those are like your 6 packs. So rectus abdominis muscle is known as your 6-pack muscle. And then other important structures in your anterior abdominal wall are your xiphoid process, which even though it's part of your bone, you can actually feel it on your chest when you lie down. It juts out just under your chest. And then your umbilicus, of course, everybody knows where their umbilicus is on their body. The umbilicus, because it's not a bone, not like the xiphoid process, it's not very stable, it can change. When you fluctuate on your weight, when you fluctuate on your position, your umbilicus is going to be lying in a different place every day. All right, so your abdominal pelvic viscera. So this is the part where we kind of get deep into what are the organs that are lying inside of your abdomen. So the location of any organ in the abdomen and the pelvis will vary with respiration, anatomic position, and the level of fitness. So when I say think about the belly board, I'm thinking about if you lie prone and your belly is sticking out under you and the rest of you is being pulled upward, then your intestines, so all of this bowel, is going to fall forward while your bones are going to remain in the exact same place. So you're able to change the position of your internal anatomy or your bowel by lying in a prone position. Same thing happens with respiration. If you take a deep breath in, your diaphragm is going to pull down, and it's going to cause all of your bowel, all of those structures to be going down with it. It's an advantage that we use as therapists when there are certain areas of the body that we need to reach. when you know how the structures of the body line up with your respiration, you can use that to your advantage. So make sure that you're never missing a structure, as long as the patient holds their breath in the same way. So to talk about the abdominal pelvic viscera, starting with the esophagus. So your esophagus, it starts at the cricoid cartilage right over here. And it travels, or sorry, right up here. Cricoid is right below the thyroid. So right over here. It travels all the way down to the cardiac sphincter. And that's actually basically like the opening of the stomach. This is about a level of T10. This is your entire esophagus. It connects to your stomach at the level of T10 where the cardiac sphincter is. And then let's do the trajectory of food. You eat food, goes into your esophagus, travels all the way down to your stomach. From your stomach, it'll come out to the duodenum. So your duodenum is this C structure right here. I'm pointing to it right now. This C structure, very important in radiation therapy because it's part of your small bowel. So it's part of your small intestine, and the small bowel tends to have a low tolerance dose. So any structure that you're trying to reach around the duodenum, or that the duodenum is very close to, you're kind of being hindered by the duodenum being there because it can't receive as much dose as, for example, the pancreas can. So the duodenum becomes a structure that you need to watch out for a lot in radiation therapy. Especially now with new technology, you're able to use MR-Linac, you're able to really identify where the duodenum is. You want to not only be able to detect it, but to see how it moves depending on how much food has been eaten, because it doesn't stay in the same position depending on how full your stomach is. All right, so moving on. From the stomach, you move on to your small bowel. Your small bowel begins with the C-shaped entry, which is your duodenum. Then it turns into your jejunum, and your jejunum in CT, it's actually going to look like a bunch of cotton balls, especially if the patient has oral contrast. It's going to look like a ton of cotton balls inside of their abdomen. The jejunum travels quite extensively, and this is where it like spins and turns inside of your belly. And then of course it turns into the ileum. It also spins and turns. And the ileum is the end of your small bowel. It connects to your cecum. This is the beginning of your large bowel. Your cecum, it's in the iliac region of your body. Remember, if you divide it into the 9 regions that we spoke about in the beginning. Your cecum is in the iliac region of your body. It's in about the level of L4. And it actually, so that's the beginning of the small bowel, and after it actually goes up, and it's called the ascending colon. And the ascending colon travels about, let's see, 15 centimeters in length up, and then it turns. And this turn is called the splenic flexure. Flexure is like a turn, and hepatic means the liver. So the hepatic flexure is right underneath the liver. This makes sense. This is where the liver is. It's on the right side of your body. It's exactly where the turn happens in the colon. It turns into your transverse colon. Transverse, again, similar to the muscle that we just mentioned, similar to the transverse plane. It goes from left to right on your body. The transverse, side to side. Once it reaches the left side of your body, it has the splenic flexure. Why is it called the splenic flexure? Because over here you have the spleen. So again, names that make sense. It has the splenic flexure and it bends down, and you have the descending colon. It's called descending because this is a trajectory that food would take, or a bolus would take. Food comes down to the descending colon, and then you have your sigmoid. Your sigmoid is kind of like this S shape almost near the end of your colon, and then finally the rectum. Okay. Let's see. The rectum starts at the level of S3 and it ends about 4 cm from the anus. And after that, the food is outside of your body. Now let's talk about the non-alimentary organs. So not where food doesn't necessarily travel. We have first the liver. The liver is the largest structure in your abdomen. It basically takes up the entire right side of your abdomen, especially when you're looking at CT scans and you're scrolling through those liver slices. It's pretty much taking up the entire side of your the entire right side of your body. Right underneath the liver is your gallbladder. It's kind of sandwiched between your liver and your pancreas. And then, I wanted to mention the superior margin of the liver is at about the level of T7. T7 and T8. Okay. So inferior to that is your gallbladder. And then after your gallbladder, they will go over the spleen. So the spleen is over to the left side of your body, completely opposite side of the liver. The spleen is like the lymph node for the blood. It helps filter blood. And they do mention in your book that if you were to ever remove the spleen for like a biopsy reason, the splenic pedicle, basically where all of those lymphatic organs kind of attach to the spleen, would become part of your treatment field for Hodgkin disease. So if you ever had to remove the spleen for Hodgkin disease and you had to treat that patient after, you're going to treat the splenic pedicle, which is where the point of attachment is for the vascular and all of the lymphatics of the spleen. You would include that in your field. And then finally, we have the pancreas. The pancreas is divided into 3 separate parts. So you have the head of the pancreas, which is right here. It actually sits right next to the C structure in your small bowel, which we already went over. That is your duodenum. So the head of the pancreas just sits nice and comfortable right in the middle of that C. Next, you have the body of the pancreas, which starts extending over to the left side of your body. And finally, the tail of the pancreas actually sits snug in your spleen, almost in the hilum of the spleen, pretty much. All right, for your urinary tract organs, now we're looking at this side of the screen. The urinary tract organs, we're going to talk about the kidneys. You have 2 kidneys. You have a right kidney and a left kidney. Your left kidney, so in this image, the left kidney is always going to sit a little bit higher than your right kidney. And the reason for this is the left kidney has the spleen right above it and the stomach, and the right kidney has the liver. And the liver, again, the largest structure in your abdomen, it is literally pushing that right kidney down, inferior. So when you're looking at CT scans and you're scrolling through slices, the first kidney that you're going to see, if you're scrolling from superior to inferior, you're going to hit the left kidney first and the left adrenal gland first. Because typically, on a normal body, not one after, surgeries and things like that, but on the most normal body, you're going to find the right kidney being squished down by the liver. On top of each kidney are your adrenal glands. These are part of your endocrine system. You do treat these, and it is common. I've treated quite a few adrenal glands, and all of these structures, the kidneys and the adrenal glands, tend to move with your respiration. So if you breathe in and hold, you're actually pushing your kidneys down. But by pushing them down and keeping them in that same position, you're able to minimize radiation to other structures. So usually you try to treat these areas, your kidneys, your liver, all of those abdominal structures that kind of move with your diaphragm, you try to treat those in breath hold. So you have your adrenal glands, you have your kidneys, and then you have your ureters, which are the kind of tubes, if you want to call them that travel from your kidney all the way down to your bladder. The ureters kind of travel anterior to your psoas muscle, which is depicted in this image, and then anterior to your sacroiliac joint, so where your sacrum and your ilium meet. Anterior to that, that's your ureter, and it goes and connects all the way down to your bladder, which of course is the structure that holds urine, and once it's full, you go to the restroom, you empty out your bladder. All right. And then finally, talking about the abdominal lymph nodes. So the way that your book describes it, the abdominal lymph nodes are also known as your visceral nodes. And there's 3 principal groups. These are known as your pre-aortic nodes. First you have the celiac, then you have the superior mesenteric, and then the inferior mesenteric. So they're going in order by how they are traveling down beside the aorta, or anterior to the aorta, I should say. From superior to inferior. So your celiac nodes in this image right up here, celiac means abdomen, by the way. So your celiac nodes are the highest up in your abdomen. So basically right under the diaphragm. Remember, this is where your diaphragm is sitting. Your celiac nodes are the most superior ones, and they actually drain the superior part of your abdomen. So we have the stomach, the greater omentum, the liver, the gallbladder, the spleen, most of the lymph from the pancreas, and the duodenum. All of these go to your celiac nodes. Next, you have the superior mesenteric. the superior mesenteric are right below the celiac, still hugging still hugging the aorta, obviously superiorly, but these are called the pre-aortic, so kind of anterior to the aorta. The superior mesenteric drains the head of the pancreas, part of the duodenum, the entire jejunum, the ileum, the appendix, the cecum, and the ascending colon. So again, if you're going back to how food travels down your body, we're kind of in the middle part of that. And finally, your inferior mesenteric are over here, down here. The inferior mesenteric nodes are draining the most inferior part of your abdomen, which are the descending colon, the left side of the mesentery, the sigmoid colon, and finally the rectum. And the other group of nodes that I want to talk about are your para-aortic nodes. So these para-aortic nodes, they travel from T12 all the way to the L4. The para-aortic nodes are kind of hugging that descending aorta. And the para-aortic nodes, they travel along the sides of the aorta. And these are, these help drain your uterus, your ovary, your kidney, and your testicles. You see treatments of the para-aortic nodes very frequently in radiation therapy. Obviously, especially in GYN cases, because they help drain your uterus and your ovaries. Very common structures that we treat with radiation. And then your para-aortic nodes, which in this image, let's see, they're right here. They're shown right here. They're kind of hugging the sides of your aorta. They start at the cisterna chyli. So the cisterna chyli is the structure here. It's actually the bottom part of your thoracic duct. Your cisterna chyli connects all of the lymph from the lower part of your body, turns into the cisterna chyli. It all comes together there. And then the cisterna chyli is basically the caudal end of your thoracic duct. And it travels all the way up until it reaches the brachiocephalic vein. All right, so those are the important lymph nodes that you need to know. The visceral nodes, also known as the pre-aortic nodes, and the para-aortic nodes for your abdomen. Okay, and last slide. And this slide is important. So I wanted to kind of go over a few structures in your abdomen and what they look like on CT. So if these three slices are obtained if you're going from superior to inferior. So more superiorly, when you look at the abdomen in a transverse or in an axial view, this is your liver. Again, takes up the majority of the right side of your body. Right side of your body, left side of your body. So liver is pretty much the entire right side of your body. This is your stomach, highlighted in blue. This is your spleen. Remember, the spleen's always going to be on the left side of your body, liver on the right side of your body. This structure right here is part of your descending aorta. Again, very important structure. It's always going down and hugging your spine, and it's always just slightly to the left of the spine. Next, we have the middle image. This slice is obviously more inferior to the first one. This slice shows your pancreas. So here is your pancreas. It is hugging right here. This green is your duodenum. Remember that C-shaped organ that I went over, the beginning of your small bowel. And this blue is your stomach. So this connection right here of the blue and the green is where your stomach meets your duodenum, where the contents inside your stomach go into your small intestine. When you're trying to reach a cancer that's in the pancreas, so in this yellow structure, all of these structures that from the GI system are very close, and their tolerance doses are much lower than the dose that you want to give that cancer. So they become very challenging. They make this area very challenging to reach. And then once again, this is your aorta. These little dashes here are your ribs. This sliver right here is actually part of your liver still, all the way down where your small intestine is. You still see your liver showing up. And then these guys right here, I focus on these much more on the next slide, but these are your kidneys. Okay, so once we switch to the last slide, more inferior, you're going to have your right and your left kidneys. Obviously, this is the right side of your body. This is the left side of your body. which kidney is lying more superior to the other one? Always the left. The left is more superior to the right. Or if you want to think about it, the right is more inferior to the left. Whatever way makes you happy. The side where the liver is on is always going to be lower. Why? Because the liver is so large. Okay? So, yes, and then all of these little gas, like air bubbles in here, that's all part of your small bowel. Okay? Kind of looks like that. This is still your descending aorta, and this is your inferior vena cava. Okay? And we'll cover more of the structures as we go down the body when we hit the pelvis next week. Thank you so much.